Welcome, everybody. I want to start today off and start the week off with something we really haven't done in about 6 weeks, which is just kind of go over what's going on with COVID because things have changed pretty dramatically over the last 6 weeks. We've not done the weekly COVID updates that at one point we were doing. My thought was, first of all, with so much else going on, there's no shortage of things to talk about. But also, let's really give this Omicron wave 4 to 6 weeks to burn through and see where we are once we close in on mid-February. And for the most part, in the United States, things are looking so much better that there are now what I would call serious discussions about moving into the endemic phase, whereas before there was a lot of kind of hear no evil, see no evil. Let's just go back to pretending everything is normal. Things are not normal now, but the discussions about next steps make a lot more sense. And as I've said before we look at the numbers, if there is not a more deadly new variant, there is sort of nothing else to wait for before we figure out what will things be like with this as an endemic thing. Now, endemic doesn't necessarily mean no risk. And to many people, it still means a risk. But the question is sort of, if not now, when? Because if we are moving into an endemic phase with no really serious new variant for 1 year, 2 years, 3 years, what are we going to do over those 1, 2, or 3 years? If not now, what would be different in 2 years if the situation remains sort of as it is now? Now, one caveat to that is, even though cases are dropping dramatically, as I will soon show you, it's going to take some time for the hospitals to empty out. We are still seeing hospitals quite full right now because of the wave's peak now many weeks ago. And it will take some time for that to abate, assuming there's no new really contagious and or deadly variant. But let's look at where we are right now. If you look at the United States, daily cases are now down from an insane peak of 800,000 cases a day all the way down to 239,000. Now, that's still a lot. It puts us sort of at the Delta peak, but with a variant with significantly lower rate of hospitalization. Remember, that's down about almost 3/4. You look at some individual states. You look at New York. New York peaked at 75,000 cases a day and is down to about 8,000, almost a 90% reduction. You look at Massachusetts. Massachusetts peaked at about 24,000 cases a day, down all the way down to 3,000. Okay, that's a massive reduction. Even places like Texas seeing a reduction only about 50%, but still going in the downward direction. And then when you look globally, the decline is earlier. We are earlier in the decline. We had gotten to 3.3 million global cases a day, now down to 2.7 million. So there are parts of the world that are nowhere near doing well, as we would say. And we will talk about some of those in a moment. But the important thing for our purposes is that we are seeing countries, states, school districts start to talk about what are the next steps. Now, in terms of vaccinating kids under 5, there's the hope. I mean, I think that the most optimistic prediction is by March that may start. It's plausible it's not going to be March, and it could be April maybe, or maybe even May. But you are starting to see a lot of places make decisions about travel. For example, Australia, which has been one of the tightest, strictest places since the start of the pandemic, will be reopening borders to international travel, as reported by the BBC. That's from this morning. So Australia starting to open. There are a number of additional European countries that are moving towards what we might call an exit from the pandemic. Italy, Switzerland, and Finland are going to be easing restrictions and guidelines. Germany and Belgium so far are not, but many other countries, Denmark and others, going back to normal, as we might say. Still, of course, with the caveat that there are going to be people who are going to continue doing whatever they've been doing. And one of the interesting things that we've talked about before is there's this discussion of when can we treat this like flu? One answer, to make it an empirical answer and not an emotional answer, one answer would be when the death rate matches that of flu. That would be something to look at. It is hypothesized that the Omicron overall death rate is about 0.2%. Flu is 0.15. So we're not there yet, but it's going in that direction. One additional caveat to that is the death rate for the vaccinated is significantly lower than the 0.2%. The death rate for the unvaccinated is significantly higher. So what you can safely the framework that you can accurately assess for yourself does depend significantly on whether you are or aren't vaccinated. But one of those questions as well, when the death rate becomes that of the flu, it would make sense to go back to normal, right? Well, no, the reality is that these 2 years have exposed for a lot of people. I wasn't as safe as I thought during flu season. And there are absolutely people who used to not take any precautions when flu was rampant during flu season. But even if and when COVID risk goes back down to match flu, it will still feel more dangerous and that people will be more aware of that risk and they may continue to take precautions. And of course, everybody should do exactly what makes sense for them in conversation with doctors and based on their risk assessment. But that's the conversation that's happening. South Korea, as reported by the Korea Herald, pushes to treat COVID-19 like flu. They have lots of cases, but low severity, relatively low hospitalizations, quite a low death rate. So that's the South Korean perspective. In New Jersey, the governor will be ending the school mask mandate next month in March. And there are many municipalities. I saw some in, and by the way, there are places that never did anything. It's like, I'm not even talking or thinking about those. I'm talking about places that did stuff are now having conversations. There's some municipalities in Massachusetts that are moving away from the masks, some in New York, a number of different places. Caveat, things are still not good in a lot of places. Russia has hit a new record. They currently have 10 times more cases than a month ago, to the extent that we can believe the Russian data. It is now 10 times higher cases than a month ago. That's not good for them. Hong Kong is bracing for more curbs or guidelines, mandates, as cases are doubling every 3 days. Very complicated situation in Hong Kong. China is locking down Baise City on the Vietnam border as cases are continuing to go up, still low numbers. And of course, China has taken a sort of, at least officially, a zero COVID approach. Now, whether that's zero COVID or zero COVID reporting, there's debate about that, but there are significant lockdowns happening there as well. So what can we do? Well, I think, again, the question is, reminder, we've been here before. What is different now? The difference is there is more support for the discussion now about moving into the endemic phase in terms of public opinion than there ever was before. But there's also more support from medical experts. We spoke to Vincent Racaniello 2 weeks ago. We've read the opinions of many other public health experts. And if things change, it will require a different approach. But if we are going in this direction, then there is this question of what are the milestones we are waiting for? And there are people who are going to keep themselves in a sort of purgatory for a very long time. That's the reality. And every individual has to balance, their risk tolerance, their health situation, and the mental health impact that is undeniable. The right is not wrong when they say there is a mental health impact of doing this. It's a question of when does the balance shift? And the answer is different for everybody. So we're going to continue monitoring all of these decisions and seeing if the downtrend continues, which if it does, within another 2 weeks, we could be 95 to 97% down in terms of daily cases. And when you have that combined with the effectiveness of vaccines at preventing death, you really have a dramatically different situation to consider in terms of what every individual wants to be doing.